Hello, my name is Dr. Gerald Chodak. I want to report to you the results of a recent large study aimed at determining if vitamin C or vitamin E could prevent prostate cancer. This study was well designed. It was prospective, randomized, and placebo-controlled. Placebo-controlled means that half the men got one of the vitamins while the other half just got a placebo or an inactive drug. That's the best way to determine if a medicine or if a supplement or a vitamin is effective for some purpose. So the study randomized over 14,000 men. They were divided into two groups. In one group, they either got the vitamin C, 500 milligrams a day, or the placebo. And in the other half of the patients, they either took 400 international units of vitamin E or a placebo every other day. The patients were followed. The compliance was pretty good. About 70% of the patients overall were taking their vitamin as recommended. So it wasn't 100% compliance, but it was still a fairly high level of compliance. And at the end of the follow-up, which is an average of 8 years, there was absolutely no significant difference in the development of prostate cancer. Prostate cancer occurred just as often in the group of men taking the vitamin or the group of men taking the placebo. So here we have further proof that these vitamins do not prevent prostate cancer. Another important aspect of this study is the importance of doing proper prospective randomized controlled trials to assess if vitamins or any other supplements impact on our health. Because without these studies, there's just no way to tell if they're doing any good. Now, two limitations of the study. Number one, they used alpha tocopherol, which is a synthetic form of the vitamin E. But there's another form called the gamma form. And it's possible that maybe the other form would have been active when the alpha form was not. The other thing is that the study was followed for an average of 8 years. Perhaps for these vitamins to work, they either have to start much earlier than the average age of 50, as was done in this study, or they have to be continued for many more than the 8 years that was looked at in this trial. Those are questions that would have to be addressed in another study. The bottom line is, at the present time, anyone who believes that vitamin E or vitamin C prevent prostate cancer, here is scientific evidence that does not support that claim. Hopefully this information will be useful to you. Thank you.